Thanks a lot, Taizo. Another school year has begun, and our Keiki's eyes play a crucial role in the learning process. Untreated vision problems can make reading and writing a struggle and could even lead to permanent eye damage. And of course, September is Children's Eye Health and Safety Month. And joining us this morning, Dr. Christopher Tortora and his son Nicholas. Thank you for joining us today, Doctor. Tell us, Keiki's eyes, it could start at a young age, these vision problems. What are some of the common health issues with the eyes?
Okay, we want to make sure that the children have healthy eyes by making sure that the eyes are straight and they're aligned and that their vision is good. It's hard to tell in a small child, but there are some ways of kind of figuring it out. We'll demonstrate that in a minute. But what you want to do is look at their eyes and make sure everything looks normal. And kind of an interesting way to do that is when you take a flash picture of a child, you get a little red reflex from the eyes. That's that red eye that we try to get rid of with some of our modern cameras. And if the two eyes look about the same amount of redness, that's normal.
Oh, okay.
But if one looks white or doesn't look red, then that could be a sign that there's something wrong and the eyes aren't aligned properly. There's something inside the eye that's a problem. Other things are you want to make sure that they can see okay. So if they're having trouble in school, that could be an indication maybe that the vision's not as good.
And are there any other health issues or eye problems that you guys see that are common in kids?
Well, in young kids, we worry about crossed eyes. So if the eyes aren't aligned properly, that can make a difference. As kids get older, we worry about refractive errors, kids that aren't seeing as well. And glasses often can help that. So things that can be corrected where glasses are necessary are really good things because we can actually make a big difference in the kids' lives. Things that need surgery or other types of treatments sometimes are a little bit longer, more detailed treatments, and those need to be diagnosed early as well for the best results.
So most of these conditions are treatable then?
Right, most things can be treated. Yeah.
Okay, so for the parent out there who may not know, I mean, children don't realize probably at a young age that, hey, my eyes are going bad, because you said it's their reality. They don't realize it. So what are some of the things that we can look for?
Well, if they're not reading things or seeing things the way they're supposed to, you can ask your kid, oh, do you see that out there? Can you read that out in the distance? If it's a child who can read, certainly that'll help. You can also look and see whether they seem to track as little children, as babies. You can see whether they track well. I brought Nicholas here along as a kind of a demonstration, as a model. So what I could do with him is if he were a small baby, I could cover one eye and I could sort of move my face around. And if his eye follows my face, then that means he's tracking properly, right? He can see fine because he's able to track. Now, protect one eye and then the other eye. Sometimes what happens is that kids will see well out of one eye, and so they function well, but there's something wrong with the other eye, and so that's a good way to pick that up.
Oh, okay. Well, Nicholas, great job following the, you've got great healthy eyes, I see. Dr. Tortora, thank you so much for joining us this morning. Great tips for families out there who parents don't even realize that they can check their children's eyes without having to go to the eye doctor. But what is a good age, actually, before we head off to break, to start bringing your kids to the eye doctor?
Okay, that's an excellent question. And actually, the pediatricians usually do a pretty good screening test for kids, and most children get a yearly well child exam. And during that exam, they check their vision and they take a look at the eyes to make sure things are okay. Another thing you can do at home, other than the photograph test, is you can take your any kind of pen light, like your iPad or whatever, and your flashlight here, and you can look and see, when you look, line up your eyes, the light reflexes on the eyes should line up, so they should be equal points on both eyes. If one is in a different position, then that's abnormal.
All right.
Eyes might be out of alignment.
I saw the reflective light there in his eyes. Well, thank you again. And Nicholas, you're off to school. Thank you for joining us this morning, an early start. Hey, when we come back here on Wake Up Today, we're going to check in with Jai, who is live looking at the Aloha Festivals.